put methane into the intestine, you get slowing of intestinal transit every single time. So it's not the bug, it's the gas. And so it led us to the thought that maybe, hey, let's get rid of the gas and treat constipation. Interestingly, it's a good predictor of constipation IBS. 91% sensitive, 81% specific. That's a darn good diagnostic test. But I wouldn't use methane to diagnose constipation because I really don't, doesn't matter. I would use methane to tell you how to treat. More important, because just simply equating the two, meaning the symptom to the methane, is very scientifically interesting, but the patient needs to get better. And methane predicts a different strategy for treatment. So let's go back to this gas dynamic. I already put this up. Methane here, hydrogen sulfide here, and just to remind you that we were missing the gas hydrogen sulfide. So we had to come up with a way to measure hydrogen sulfide. And this is a new device, sort of a prototype in a sense, because this is a working model, but it doesn't look glamorous. It's just a box with equipment in it. But we were able to finally combine hydrogen, methane, carbon dioxide, and that new gas hydrogen sulfide. And just to simplify it down to a very few slides, hydrogen sulfide is diarrhea. For every part per million rise in hydrogen sulfide, we saw a 15-point rise in severity of diarrhea. And severity of diarrhea relative to constipation. Remember, all these patients have bowel trouble. But we never saw an association between hydrogen, that gas we always measured on the breath test, and symptoms. Your hydrogen could be 100, you still have overgrowth. Your hydrogen could be 50, you still have overgrowth. But you weren't more bloated because you were 100 or 50. Methane is proportional. The higher your methane, the more constipated you are, the more bloated you are. The higher your hydrogen sulfide, the more diarrhea you are. So by adding hydrogen sulfide, we now have a comprehensive examination of the breath test and how it relates to symptoms. But more importantly, there are patients who do a breath test and they come back, doctor says, oh, it looks fine. It's not fine. It has hydrogen sulfide. We just couldn't measure it. But the patient feels disappointed, feeling like, I thought I had overgrowth. I felt like it. The symptoms were all there, but it's negative. But it's not. And so a good proportion of these patients have a positive hydrogen sulfide. So let's jump now to treatment. So now that we've sort of wrestled with the breath test, remember, I could talk for hours and hours on all the data because I'm trying to sort of get the seminal things down for you and not to get too far in the weeds in different things. But in question and answer, happy to address more deep questions. But I probably have a 1-hour talk just on hydrogen sulfide, just to give you sort of a flavor for things. But let's jump to treatment. I'm going to populate this whole slide because it's really important for you to kind of see the whole comprehensive picture. In the middle, there's a line that goes down to a number 1.0. Anytime a line and a dot is on that right side, it is statistically significant. This was the New England Journal of Medicine paper showing that rifaximin, an antibiotic, could work in irritable bowel syndrome on the basis that IBS is a microbiome disease. And you could say SIBO. Wasn't stated that way in the FDA filing, but you could say that, and we'll talk a little bit about that. But it's basically saying that you're giving an antibiotic that's non-absorbed, and it really isn't an antibiotic in the conventional way because you don't get resistant to it. You don't get changes in the stool microbiome. The bacteria of the gut appear not to get resistant, as I sort of said, and so, but all symptoms improved. Pain improved, bloating improved, stool consistency improved. The new FDA endpoint, which is this combination of abdominal pain and stool daily consistency, improved. So everything was better.